Let's continue our conversation on the topic of complex carbohydrates. It's part B. Why people with diabetes type 2 should eat complex carbohydrates. Here on the slide, you are looking at the graph. Blue line represents simple carbohydrates. When we eat simple carbs, concentration of the sugar immediately goes up and high. And then when insulin gets released, concentration will drop. Complex carbohydrates are red line. When we eat them, sugar never goes that high and never goes that low. It's important to understand, and I will explain you why it is so important in a second. But I would just want to elaborate again. This slide represents how complex carbohydrates are important. They're long-term, excellent long-term source of sugar for energy for us. They're a source of nutrients and also prebiotic. This complex slide, I wanted to show you that when we eat carbohydrates, they are a source of energy for us. And they broken down, incorporated into Krebs cycle, and energy get released. But look at that. What is important here, I want to stress, how much nutrients we need to break it down. We need vitamin B1, B2, B3, B5, magnesium, lipoic acid, and complex carbs have them all. Now, patients used to complain to me with diabetes type 2. They often will eliminate all sugars. And then they will come, yeah, not exactly, maybe it's working, maybe, but I don't have an energy. You must understand, sugar is the main source of energy for us. We cannot eliminate it. Brain depends on the sugar. Red blood cells depend totally on the sugar. So question becomes, what kind of sugar you need? Do you need simple carbs or do you need complex? And the answer is you need complex carbohydrates to make sure that you have energy both for the brain and for red blood cells. Let's go to the blackboard for the explanation. As always, I already pre-draw my favorite picture of the digestive tract. This is the mouth with the teeth. This is esophagus, low esophageal sphincter, stomach. Pylorus is here, small intestine, large intestine is right here, and then we go to the bathroom. When we put carbohydrates in our mouth, they go through the stomach and immediately into the small intestine. And only simple carb, only one this circle will get absorbed through the digestive tract into the bloodstream. Let's draw bloodstream as red. This red pipe is a bloodstream. Okay, like that. So one carbohydrate get absorbed through the digestive tract, and here it is in the bloodstream. Immediately, it gets detected, and pancreas, here it's located here, P stands for pancreas, will start to produce insulin. So insulin get combined, this is the insulin, with the sugar, and this insulin sugar complex will go into the cell. At the border of the cell, they get separated, insulin will stay behind, and sugar will go into the cell and then into mitochondria, where the energy will get produced. So let's draw like that, energy. Now, you need to understand that there are big difference between simple carbohydrates and complex. Simple carbohydrate, when you look under the microscope, looks like that. Piece of sugar connected to piece of sugar and connected. Let's draw the one more piece of sugar here. Complex carbohydrate looks different. Sugar and this sugar. And by the way, this is important to understand that this sugar in simple carb is the same as this one in complex. So complex carbohydrate look like that, but look at those all sugars in the complex carbohydrate. They are interconnected. So this one connected to that one and connected to this one and here and this one and here. All of that is connected. When simple carb get into the small intestine, enzymes there will start to break those connections here and here, and this sugar get released. So this is the sugar. Takes only to break two connections. Complex carbohydrates, when they started to be digested, in order to get to, let's say, to this piece of sugar, look how many connections need to be broken. This chap, 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 chap. All of this chapping takes time. To our digestive tract, it's not important which sugar you eat, simple or complex, because in both sugar looks absolutely the same and they will be absorbed. But what is important, what's the difference between simple and complex, is number of those connections. And it means that to break all of those connections to elicit this one takes time. And time is important. You already saw in the beginning of my presentation, this graph. So if this is the concentration of the sugar in the bloodstream, and here we have time line. So this is the time. When we eat simple carbohydrates and it takes no time to break those only two connections, concentration of sugar in the bloodstream will go high. Insulin gets released, and because sugar is going fast, insulin is usually overshooting. As a result, sugar drops down immediately. When sugar is high in the bloodstream like that, okay, we are very high. When sugar is low like that, we become low. We don't have energy because neither brain nor red blood cells can work without sugar. So complex carbohydrates never behave this way. And by the way, this takes about 1 hour. Complex carbohydrates, because of number of connections, never sugar goes that high. And then slowly, 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 takes about 3 hours to get it lower. Now, suppose you ate simple carbohydrate. So sugar, insulin get delivered into the cell and we start to produce energy. So energy is need to exercise. But what if you don't exercise? What happened to this extra sugar? That its concentration of sugar in the bloodstream is high because you eat simple carb. If not used, and I mean, it's right here, sugar gets high. It's about 20 to 30 minutes after the meal. Let's say 30 minutes max. Okay? 30 minutes. What will happen to this sugar? It needs to go to some place. If not in the cell, you don't need an energy. It will go into places. The first place is the liver. So it will go here into the liver. Let's draw the liver here. Here is the liver. Liver will take about 100 grams of sugar. If liver is full, it's gonna take more. Then what's going again to this high concentration of the sugar? It's right here. Then the next, it will go into fat. That's why people who eat simple carbohydrates like bread, pizza, pasta, soft drinks, juices, cookies, candies, they tend to be obese, right? Then you try to get rid of this fat. Impossible. Now, what is important to understand here, that the difference between simple and complex carbohydrates, it's all about the time. If you ate complex carbohydrates, you have a time frame about 3 hours to digest it and to use it. I assure you, in these 3 hours, you probably will be doing something, maybe walking on here and there. Okay, so we need sugars because we need to feed brain and we need to feed red blood cells. So you cannot eliminate sugars. Eat complex carbohydrates. Now, do not run to the kitchen and start to cook brown rice. If you have not been eating complex carbohydrates like brown rice, quinoa, amaranth, steel cut oats, they all are complex carbohydrates. then you need to start to do it slowly. Cook maybe, cook a little bit and eat maybe 1 or 2 tablespoons and see how your digestive tract is able to tolerate it. People who never or infrequently had a complex carbohydrates, because of the high concentration of the fibers, they may feel that they become a little bit more gassy than usual. So it will take time, several weeks, before the body will adjust to eating complex carbohydrates. And also remember, complex carbs are a source of prebiotic for us. So that's it, guys, for today. Thank you. Like, subscribe. Bye-bye for now.